Tuesday, August 11th meeting of the Sawyer County Health and Human Services Board to action. Roll call.
Jennifer Vabornik, Dawn Pettit, and Lorraine Gouget are absent.
Okay. Was this properly noticed?
Pardon me?
Yeah.
Yeah.
You don't know?
Yes.
Okay, thank you. So everybody that is on here virtually knows how to get your attention?
Mhm.
Thank you. Okay, audience recognition. Do we have any audience?
You do the agenda.
Oh, that's right, first. First, we need to approve the agenda with recommending that we flip-flop Child Protective Services and Public Health. And we flip-flop the last two items as well, 8 and 9, so that fiscal comes ahead of any items for discussion, only future agenda items.
I'll make that motion, Mr. Chairman.
Thank you. Motion.
Second.
Thank you,
Carol.
Second. Any discussion? Anybody in favor, say aye.
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 Anybody opposed? Same sign. Motion passed. Now, do we have any audience?
Dawn Pettit has joined too.
Okay, I was gonna say that Dawn said she could not log in, so she must have got on.
Okay.
Good.
Minutes from the previous meeting.
I looked them over, they look good to me, Mr. Chairman. I'd make
Mr. Olson, second by Mr. Schuman. Approve the minutes of the previous meeting. Aye.
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 Anybody opposed? Same sign. Motion passed. Committee report.
Lorraine's not here.
Lorraine's not here. Okay, Senior Resource Center. I would like to announce that if there's ever going to be a discussion about the Senior Resource Center, let me know ahead of time so I can recuse myself and step out of the room because my wife is now on their board.
Okay.
So I don't want to be caught up in that mess.
Sure.
Okay. Senior Resource Center, did we just accept that or we
Right, it's just information.
just information? Okay.
Is there anybody here from Senior Resource Center?
Not aware of.
No?
Now, Julia, you're on Public Health.
Okay, I'm going to share my screen. There. PowerPoint up from the big. Okay, there we go. Can everybody see my screen and hear me okay?
Yes.
Okay. Thank you. So this is as of today, the latest and greatest. So I completed this later this afternoon. It should have our latest numbers in it. So here's where we are currently with COVID cases. This is cumulative over time, and this graph definitely gives us the picture of we've had quite an increase since mid-July. Of course.
You got the dogs again.
I have people cutting trees down in my yard at the same time. So, and 160 suspects. That's a new thing that I have out for you guys to hear about. The suspects are the number of people that we're tracking with cases. So there we go. And 2852 negative. Now the negative count isn't as important as it used to be. When we originally were giving numbers way back in April and May, tracking our negative was really important for us because it helped us identify that we were getting enough tests in the community to know that we were really kind of covering a wide range of people. Now the negative tests aren't as important for this because we know we're doing a lot of testing. What I would be using the negative tests for now is to look at the number of negative tests to the positive tests, and I want to have less than 3% be positive of all the testing. And the reason for that is they've shown that countries that do fall at 3% or under on the positivity rate are getting enough testing out there so that they can control the spread. I don't have the positivity rate for you today. My data person is on vacation this week, so as soon as she gets back, she'll be able to pull those numbers for me. So hopefully by the time we have board meeting next week, I can give that. This is the daily cases, and so you can see as the cases come through. And can everybody see a way over to the right-hand side of the screen, or is it all getting blocked by people's faces?
We can see all the way through the gray lines on the right.
Oh, perfect. I just wanted to be sure because mine gets blocked by the images, so I want to be sure. So the gray lines are there. This is a state generated graph that I'm using today. And gray lines are just preliminary data because they don't have all of the information in from us at this time to confirm that they've been closed out. And so that's why they're gray. So you can see that we've definitely had cases increasing, and we are actually, we are not seeing a day without a positive case since July 25th. We've had at least one positive case a day. I think our high was 8 cases in one day. So it's been a lot, but the team is doing really good. We're keeping on with identifying our positive cases and notifying them within 24 hours. We're having contact and identifying who their close contacts are and getting people in quarantine. We're kind of burning both ends of the candle at this time, but we are recruiting and we have people that can come on board and do additional contact tracing. So I was keeping up with it, but all of a sudden it hit pretty quickly here, and we need to get a couple more people on. The nurses are working 24 or working all 7 days a week. We don't have a whole lot, so they're doing a lot of weekends and getting that coverage taken care of. So I just want to say kudos to that team because they're doing an awesome job. The other piece here is this data reflects 2 weeks of data. Unfortunately, our meeting is on Tuesday versus Thursday, so this is last week. Our rate per 100,000, I believe, is up in the 200s now if we calculate that. Our burden is high. So I anticipate when it comes out tomorrow, it comes out every Wednesday, our trajectory will still be going up. And you can see Bayfield is starting to come down. They were in the dark color before, and Russ County has been staying in that medium. They've been really hanging out there, so not sure how they're managing that. This is a new picture that I don't think people have dug into DHS website enough to be able to see. Some things, it takes a lot of digging, and I probably wouldn't know about them if I wasn't on a health officer call. So this is census tract data. And I think that this is something that I know people want more information. Where are the positive cases and what's happening? The data in the census tract, if there are less than 5 cases in a census tract, it's just going to show as white. And once we start getting cases up there, then it'll turn to pink and then dark pink. And then you can see down in Barron County in that bottom left-hand corner where it's really dark, that's the next color that you can see. So,
Julia?
yes.
Yeah, I think we have a question.
Oh,
Dawn?
go ahead. Yes. Dawn, go ahead. I can't see you. Just speak up.
Dawn?
I don't have a question now, but after.
Okay, we'll make sure we leave time for questions. So this is another piece that I wanted to kind of go over with everybody. And people have been asking about cases, getting a little bit more case descriptions. So what we've seen in the past 6 days is almost everybody who's become positive, they've known that they've been in contact with someone who was positive. Prior to that, the week prior, about 50% of the people didn't know where they got it from. And then another 50% could identify that they were a close contact to a positive case. So what that was telling us is that we just didn't have enough testing in the community. There was undetected cases. Part of this, I believe, is due to the symptoms that have been fairly mild for many people. So I'll get into that in a couple other bullet points. The other thing that we started to see about a week and a half ago was teenagers testing positive. Washburn, the previous 2 weeks to that, had a lot of teenagers. They've been attending parties. And so it's really difficult to do contact tracing. Nobody wants to give up any names. But the good thing is what they tend to do is they say, hey, I'm positive and you should go get tested. And they put it out on Snapchat and then all these kids go in and get tested. So we're getting the testing done. And the important thing would be we would want to identify those positive cases. So it's not quite up to how we like to do things in public health, but at least we're getting people in and getting tested. The other question that's come up to me is some counties are really having troubles that people don't want to share who their close contacts are. We've had some of this we've kind of butted up against the last week, but for the majority, people have been disclosing their close contacts to us. And this is important because if we don't get people in quarantine before they get sick, we're going to continue to spread the disease. So, and then the main symptoms we're seeing are allergy-like symptoms, fatigue, body aches, slight cough, and or GI symptoms. We have a rare few who are getting extremely sick that require hospitalization and maybe an emergency department visit. But otherwise, and I would knock on wood, but you know my dogs will bark, that we're doing really well when it comes to that. So I'm very thankful for that. The other thing that I wanted to go for today, you're getting kind of public health 101, you guys. So other thing that has been a lot of questions that have been out there that I want everybody to be able to kind of speak to is who's considered a close contact. And I created this little chart here on the left-hand side of the screen to kind of show who is a close contact and who isn't. So you have a positive case. If there's direct contact to that positive case, and we'll go over what a close contact is, then they're a close contact. But what we're getting is people who said, well, I hung out with so-and-so who is a close contact to a positive case. Those are not close contacts, not unless that other person becomes positive. So as we go down, getting into that third level of contact, they are not considered close contacts and they are not at risk, at least from that contact. A close contact is a positive. Well, let's just talk who's a positive person and when are they infectious. When they get tested positive, what we do is, Sophia, what we do, now you know my dog's name. What we do is we look at the infectious period is 2 days prior to they started having symptoms. Sophie, sorry. Oh my gosh, I'm so embarrassed. Okay, and if you spent 15 minutes or greater time with that person who is positive and you've been less than 6 feet apart from them, then you're considered a close contact. And that's even if you're wearing a mask. And I think that, all of this mask wearing that we're really trying to encourage people to do is causing us to think that we can just hang out with people and wear masks. The reason why masks still don't prevent you from being a close contact is we all wear them differently. Some of us have a thinner mask on that aren't healthcare grade. They might not be covering your nose, all that type of thing. The other thing that makes you a close contact is if you stayed overnight at each other's home during the infectious period, and then shaking hands, hugging, kissing, cleaning up Kleenex, sharing towels, and drinking glasses. So that covers that one. Any questions on close contact? Okay, gonna jump into the next one. Isolation and quarantine. So positive cases are put into isolation for a minimum of 10 days. They're asked to stay away from household members, wear a mask whenever someone else is in the same room. Sometimes you can't avoid the kitchen area. Use a separate bathroom if you're able to or have a second bathroom. Somebody else should do your shopping. You monitor your symptoms. And if symptoms are improved at day 10, you can be released from isolation. Quarantine is for people who are close contacts, so they're not positive. And that lasts 14 days. And I'll get into the reasons for that in the next slide, but it's the same thing. We're asking them to stay home, using separate bathrooms, having somebody else do your shopping if you're able to. We're also asking close contacts to get tested. And we do that not to get them out of quarantine, but if we can identify their symptoms really early on, then we're able to do contact tracing right away and make sure we get other people out of the community. We're also asking them to monitor symptoms for 14 days, and if they don't have any symptoms, then they're released from quarantine. So some of the questions that are asked is the difference between the 10 and the 14 days. So when somebody has COVID, they typically resolve their symptoms by day 10. And the shedding of the virus has been shown to be very minimal. So they can be allowed to come out of isolation. They are working with the public health in order to make sure that we've identified that the symptoms have resolved and we can release them from isolation. But now when it comes to contact, close contact, what happens is that when you've been exposed to somebody with COVID-19, it can take you 14 days before you become ill. So if we shorten the time that you're in quarantine, we could release you, you become sick, and then you exposed more people. Usually we're feeling pretty good by day 12 that most people, if you think of that bell curve, most people have been sick by then. And then the other question is, and I alluded to this before, if I test negative, can I get out of quarantine? No, because it still could take you up to 14 days to become ill. And then business owners and managers have asked if they should require a negative test before letting someone come back to work after they were positive. And no, we don't want them to do that. And the reason for this is people can test positive for up to 30 days after they've resolved their symptoms. And this is because the test is so sensitive that it not only identifies live virus, but it will also identify dead virus that's still shedding. So shedding dead virus doesn't hurt anybody, but it can show up in those tests. This is your final slide. You can stop listening about COVID. So what can we do to slow the spread? Everybody needs to be following the masking orders and ask others to do so. Keep your close contacts as small as possible. So the more people that you're exposed to, you're likely to come into contact who has tested positive or will test positive. Again, we don't know what everybody does in their other parts of their lives. And if they attended a big party 3 days ago, we might not know that. All of us should just be monitoring ourselves. If we start to feel like we're getting a cold or allergies, we don't want to ignore this. This is how it seems to be identifying itself in a lot of people. So get tested and stay home until you know your results. Limit your activities in the public, and then I need help with everybody to encourage your friends and family to follow the guidance above. The only way we're going to get a handle on this is if people really start to take it seriously, at least to try to slow this spread. It's hugely important before school starts that we get a better handle on this. Okay, so Dawn, you had a question.
Okay, there's several of them, and you're not going to like me for this.
Go ahead.
I've been fielding emails.
Okay,
I want to say at least 6 a day.
okay.
First off, fair. How are we going to go? How's fair going to go in 2 weeks if we're at 78 as of tonight? And we know where we are in the migration pattern of it. The cases are going to continue to increase. How are we going to allow the fair to go?
Yeah,
That's my question.
I need to talk to Rick. They've emailed me and I just couldn't get back to them today to talk through things. So we got to figure this out.
The question I'm getting is how are we going to rely as a community on carnies to wipe down the rides or ensure that we're going to be safe? That is not their responsibility. And I would think it would put a liability on the people that own the carnival. So I wouldn't think their insurance company would cover that. They're not experts in this, nor are any of us. But that was my one.
Okay. I hear you on that one, Dawn. I'm working on that one.
Okay. The next is restaurants.
Yes.
I've taken from the older generation. I've been out in public. I've gone to the grocery store. I've been at the gas station. They are furious, absolutely furious that they are not, and I'm going to specifically talk about my area. No mask, no social distancing where you go in and they're supposed to be 6 foot apart in a limited occupancy. And it is completely jam-packed. And they asked, why is no one masked and why are we not social distancing? They were told, we don't have to and we don't want to. So if I hear one thing about we did not make our tourism money, that is absolutely a joke, because I can guarantee you down here, there's all but one establishment that is still doing, they will bring the food out to the car and has limited their dining area. I had people telling me they're all going up to the Delta Diner and Cable because they cannot get into a restaurant down here because no one is following the guidelines. The next thing was...
Hey, Dawn, before you go on to the next thing, can you tell people to email or call the masking? I don't even have that up. I can send that out to everybody. A mask information email or our phone number, because we need complaints to come through that helps give us support, because if you're going to lose customers, that helps with businesses making decisions.
Right. And the bars and and down here we have bars and restaurant, which is Slash. And I'm not going to name the businesses right now, but there was 2 of them they went into, and then they said, absolutely. Well, and they asked, why are you not wearing masks and why are you not 6 foot? The tables aren't, like I said, she's not making us, we don't have to. It's up to you. And there's signs on the doors saying, we don't require you to wear one and we're not going to ask you to put one on.
Really?
Yep.
Oh, okay, we'll talk. We have to talk offline, Dawn.
The other thing was website. I had gotten some questions about the website, the county website, that it's kind of, I know you guys are completely busy, but if you look at some of the other county websites, they're a little bit, I hate to say this, prettier, or, a little more information. And I know what they're getting at, they're paying their tax dollars, blah, 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 blah. Then I got a complaint about the building.
What building?
The county building.
Mm-hmm.
That they had been in the county building, water fountain, is still being used. Phone, computer, I wrote this down. Phone, computer, copy machine, nothing to wipe it down with. Bathrooms, no max person capacity sign or anywhere on the building if they're limiting. Like if the example was, like if you have 3 stalls in there, you can only have max 2 due to the 6-foot distancing. I said I would relay it to who I needed to.
We'll get that. We can get that
I
to
know.
custodial.
So I'm just giving you guys all what I'm getting, and I'm trying to handle it all and just tell them, you know, I had a huge, it was about the restaurant and how upset they were. And then I'm sure they talked to all their friends because they must have been going out, you know, trying to go to dinner someplace together and meeting up. And they said they're not gonna spend their money down here. That's it. If they have to go out of, they actually told me they will go out of the county if they have to spend their money.
Thank you, Dawn. And that's probably the best thing to tell everybody. If they go to a business and they're not following the masking the way they should and the separation, just turn around and walk out. That'll make a stronger message than anything. So I think we've got some other questions people want to ask. Tweet you.
Yeah, I do. Julia, what is your interpretation of our sheriff's statement where he said he will intervene if the owner of the property is asking someone to mask or to leave if they won't mask and they refuse to leave? Is that where he's at, or how do you interpret that?
Yeah, and so the sheriff will help support us. So here, and let me just do the 320, or the masking mandate feels like it was so long ago, and you guys haven't met with me since then. I should have put something more into that. So with the masking order that came out, it's under the emergency order, which is statute 323. And statute 323 does not fall under something that the sheriff can write a masking ticket for, like they can a speeding ticket. The 323 actually needs to go through the DA in order for that fine or for forfeiture to happen. So what was happening was the dispatch and actually 911 was getting inundated with people having questions about how he was going to enforce this and what we could do. So putting out the message, and it didn't come out the way that it was intended. So the message was intended that the sheriff will be responding and make sure that he supports business owners to get done what they need to get done. All other issues and complaints should go through the mask information email or the hotline. Public health will actually be investigating that. What we're doing right now is the complaints are coming through. We are getting phone calls, and we are starting with an initial letter to these businesses, letting them know that complaints have come through. We'll also be working with the chamber on that as well. The other thing is the sheriff and I have been working very closely together throughout this whole time. So if I need to go and investigate a business that just is absolutely not going to respond and work with the masking order, and I have concerns, the sheriff will be with me and supporting me and making sure that I'm safe. Did that fully answer that question for you? And actually one more piece, Tweed, we will be, I'm gonna be working with the sheriff. We need to re-message out to the community that the sheriff and I are working hand in hand with one another, and we need everybody to be following the masking guidance.
Yes, thank you.
Mm-hmm.
Okay, any other questions? Julia, I was curious, that number 160, I think it was, that you had for positives.
Suspect.
Oh, suspects.
Suspect.
Yes.
How many actual cases of COVID-19 have we had in Sawyer County?
76.
76. And that's since the beginning.
That's since the beginning. More than half of those have happened in the last couple of weeks.
Okay. How many people ended up actually having to go into the hospital for overnight stays and for treatment?
So we have 3 on there. The interesting thing about this is some of them were related to other issues as well, but when they're positive with COVID, they show up there. So.
Okay, thank you.
Julie, I have one question for you.
Yes.
So in the last 2 weeks, we've seen this huge spike in cases. So what happened 2 weeks ago? Have you guys figured out a pattern as to what changed? Because we were doing really good up to that point, and then something suddenly changed. If you
It was really, it started with 4th of July. And when you kind of look back, our numbers started creeping up, and and people weren't identifying that they were sick. So parties and different things kind of happened at the beginning of July. And I kind of attribute it to everybody's just getting sick of this. And our numbers were low, and let's go out and have a good time and let's have fun. And then as soon as you start getting a couple of cases that really truly are not tourists, because tourists leave, but our people stay in town and they go out and they connect with people and they do different things. And I think that's where we're really started to see it. And people weren't identifying themselves as really being sick. They were thinking it's the change of the season, kind of allergy kind of things. The symptoms are starting out very mild. And for some people, they aren't even getting horribly bad. So, and if you just keep going out, you know, how we normally would, we'd go to work and we'd do whatever we're going to do and think, yeah, it's just allergies, or just a little sniffle. It can't be COVID, because I think that we all think COVID is going to be something that, you know, you're laid up in bed for 10 days, and that's truly not the case. So the risk is, and so as those start to accumulate, I'm not surprised where our numbers are. When I started seeing the cases that were they couldn't identify where they got it from, that typically then will show you that you're going to kind of double that up again until you start to get people testing and realizing that there is a problem. So hopefully we're starting to get enough testing, people going in with symptoms and identifying out, that we can start to kind of see this. I'll probably peak again next week, or possibly 2 more weeks, but then I'm hoping we kind of level out. One of the things I am going to see if I can get done with the state is some look at our numbers to see if they can give us some type of projection as to how long they think that our spike will keep going.
If I can ask something.
Yep, Dawn, go ahead.
You think that we're going to lull out in 2 weeks and we have Labor Day coming up? That's going to be another where we're going to spike 2 weeks after that. We're taking on so many tourists right now because we can't go to Illinois, but they're all coming here, and Canada has the border shut. So where is everybody else? Where is everybody at? Southern Sawyer County and Northern Sawyer County.
I'm not saying we're going to low, but I think that we might stop our peak a little bit, peaking, like, because we're on a rapid upright trajectory. If we can start to curve that a little bit, because we're starting to get a handle with the testing, we'll hopefully be okay. And truly, Dawn, I don't know what's going to happen when school starts. I can't even make any projection what that's going to do.
Right. I'm just thinking about Labor Day. We had 4th of July, then we had the spike, and we're rising and rising, and it's going to keep happening. And in 2 weeks, now we're going to have the fair, then Labor Day, and that's when everybody is up here again. Are we going to put any
advisories
out saying don't come here, or Minocqua has gotten hit? That was just on the news that Minocqua is taking on cases. Lac de Flambeau was shutting down buildings. The tribal government board tweeted, they put the order that, safer at home or stay at home. I don't remember what it's called.
Yeah,
But
similar to that,
What
yep.
are we going to, what are we going to do? We have to protect ourselves. There's people coming here that do not care about the residents, the citizens that live here.
We definitely need to get the masking and we got to get the businesses on board. So anybody has any recommendations for helping to get businesses on board with this, that would be very helpful because we can't have businesses saying you don't have to mask. And I need to know those businesses. So
Maybe pull liquor licenses?
no, I don't have that authority.
Well, who has the authority to threaten them? Well, not threaten them, but
Liquor licenses are owned by the district or the municipality.
no. Yep,
Mhm.
I remember
Mhm.
that.
Yep. So yeah, I can't touch that. So and the way that this order is written, we don't have a lot to stand on. You know, the Supreme Court really kind of pulled the power out, and especially that they overturned the governor. They're not sure quite where this is going to go. So I need to work as hard as I can with education and getting out there and talking to people. So we need to identify these places. I need those to go into our information line so that we can follow up on them. We have opportunity to get boots on the ground, even if it's not me and it's my environmental health team. That's the first step to getting that education out there.
Okay, thank you, Julie. I really do appreciate all the work you do.
And Dawn, we are working on that darn website.
Okay.
I know, I don't like it either. I went on
Thank
to
you.
Mansfield County and I said, yeah, ours looks so bad. We will get there.
Okay,
Yes,
thank you,
so-
Julia.
Oh, you're welcome. Need to stop sharing here. Thanks, everybody. Appreciate the questions and the comments. It does help me.
Thank you.
Bye-bye.
Alex, can you send me that? She sent me.
Okay, Dave, you wanna? Child protective services?
Carla. Carla.
Carla.
Carla McKay.
Oh, Carla, I'm sorry.
Right here.
Okay.
Hi. I was thinking this off.
Technically, no.
Okay. I was asked to report out on home care people that we have and yes, really. So I looked at our digital checklist, which is the child practice computer system. And that's the report ran today says we have 32 states here, 14 female, 18 male. 20 of them are in foster care, 6 in RCC, 3 in child education, 1 in a group home, 1 in kinship care, and 1 in supervised living. That's what our status report says. I have some doubts on that. But that's what they say we've entered. So that is the county as a whole. Then for the children that are in care that are county placed, we have 6 children that are county has placed in home care, 2 females, 4 males. 3 of them are in foster care, 1's kinship care, 1's in RCC, and 1 is independent living. Then ICW, who we have no jurisdiction over. We have a 161 agreement with them. A lot of people say to me, why don't you tell them no, that they can't place our 161 agreement? That's not a 161 is purely our agreement, how we're going to pay the children in care and what they need to get us, and then how we send out, get money from our own state dollars. So they do alert me when they are placing. on. And we let it go there. So this is ICW's numbers. Great. Children in here for them are 26, 12 female, 14 male. They have 17 children in foster care, 5 in an RCC, 3 in trial reunification, 1 in secure home. I can give you more statistics, like what's the age group, what's the type of kids in here, special abuse, neglect, number of placements, how many times they've been, how long they've been in here, length of stay in here. I can give you all those statistics, but that is it in a nutshell. For the county, that's about average. That about 6 kids in here.
I got a question. Carla, how many, so that's a total of 11 or 12 kids in RCC? Did you say
Oh,
6? 6 in the county and 5 from LCO?
1 from county.
5 from LCO. And you said that we get federal and state dollars for these kids?
Well, you gotta claim different pots of money. Yes. I do not.
Right.
That is one pot.
So that's in our budget then? Because I was looking at our budget that they proposed last meeting. And we're gonna be way over budget for RCC. I mean, we had budgeted 320,000. I think it says we're gonna hit almost, what is it, Paul? 6. Well, expected, projected 730,000.
Patty,
So that's
you should
double.
hand me the phone.
Well,
Patty, I'm gonna let you handle
well,
it.
before Patty gets to the phone, I'm gonna say, the reason you were invited, we also invited to Bishop Rice, the
Yeah.
LCICW director. She couldn't make it, she was working at the voting outfit tonight. And you were here because what's driving the cost of high cost placements. And the conversation had previous to the last board meeting, you indicated those were LCO travel members and high cost placements. And we wanted to have a discussion with you at this about, how does that discussion go between you and decide, how does somebody decide if somebody goes in high cost placement? How is it monitored and how long are they in there? Now, I know you did reach out to this place to try to get some kind of statement from them. I don't know if you got one, but it was really, we're focusing on high cost placements because of the goodness of the budget. And are they necessary? How do you determine what's necessary, how long necessity has to last?
Well, we really,
Thank you.
we really don't have to say so there, right?
Right.
They choose, and then we pick up.
They choose.
ICW chooses where the tribal government chooses where their children go. I might have misunderstood you. Did you say that some children are placed more than once, several times?
We could have them take care of their parents, do better, and then return home. And
Does that normally happen a lot? I mean, where they're in and out?
then, not anymore.
Good.
Not anymore. Used to, but not in today's.
It's kind of a touchy situation because LCO can do what they want to do with placing the kids.
Right.
We just wanted to have a discussion, and between you asked for this, to talk about how is that determined? Are we being as vigilant as we possibly can? And it's not trying to step on any toes, but just I'm trying to understand the process. Because it ends up impacting both the county and LCO.
Right.
Right.
And maybe it has to do with cultural settings and the appropriate for the children because they're Native American. So I don't know.
I don't either.
I don't know those answers. Maybe they don't have as many foster care or kinship or.
I know that for a fact,
Okay.
that we're really short on foster care placements and families. We were looking at how we could license more people on the reservation to take these tribal kids.
Yeah.
I had a lot of questions about this RCC being so expensive and over budget. And these places are probably not on the reservation, correct?
And there again, wouldn't it be better for the children to stay within their communities?
Absolutely. So that's why I did want to listen to input on this.
Yeah, okay. So you're going to do a follow-up?
Yes.
Okay, thank you.
Any further questions?
So you're going to follow up individually with her then?
Yeah.
what makes kids go to different levels, I should explain that. RCC is a hospital.
Right, I know what that is.
And it's usually when kids are pretty significant. And I do know one of the children there really does need better. The rest I think.
Is there some sort of an evaluation? How is it determined? Is it one social worker, is it staffing, or how, medical and or how is it the determination made as to the need?
I think ICW does it similar to us, but it's
Okay.
worker get to know the family based, and then if safety issues are present that meet Wisconsin state law standards, then they can look at other services. And one of those services, the harshest is out of home. Okay. Thank you.
Okay, thank you.
Thank you.
Fiscal 2021 budget.
It's follow up on initial discussion last month. You learn on, but,
Yeah, I mean, Danny went over the big by big budget document that you had from last month, so entertaining any questions, comments on that. As we recall, at this point in time, we have the departments submit their departmental budgets. The Health and Human Service budget, the initial budget submitted was about $760,000 over or short on revenue as compared to expenses. So a lot of that is driven, of course, by the out-of-county placements. We talked about that a lot a minute ago. Other out-of-county, NODA. And how do we handle that? Historically, we've not budgeted at all for that. Starting about 2015, we started budgeting and started kind of ratcheting it up. And so this budget does have increase in those line items, but still, the budget is $760,000 out of balance. We can handle it in a couple of different ways, and it kind of depends on how the other departments come in with their budgets. But to get everything in balance for the whole county, obviously we can't do that far out of balance. So a couple of different scenarios that we can look at. What we're looking at is either cutting services to get in balance, and we've done that over the years. As you talk to supervisors and all of the services that are provided, a lot of them are mandated, those that are not mandated. If you cut them any further, it causes significant, issues with the health and whatnot of the individuals that they are servicing. So, not a great alternative to cut services even further. The other alternative, even though that we've been under budgeted in those line items over the years, overall in the Health and Human Services Department, overall budget, the actuals have come in better than budgeted. So we have been building the fund balance within Health and Human Services over the years. Back in 2015, the fund balance, fund balance is what's left over. If you've got more revenues than expenses, you've got a positive fund balance, and that can accumulate. So back in 2015, we only had about $100,000 of fund balance available. That's increased steadily every year. As of the end of 2019, we're over $1 million of fund balance. So we can, take a hit to the budget. I mean, even if we didn't meet budget this year, that's what fund balance is for, is to help you in those years where you've got trouble balancing the budget. With that $1 million fund balance, that could help ease transition over, trying to ratchet that those line items up, but to go from 0 to 60, in a year or two is difficult. And you are in a scenario of cutting services pretty drastically. So, as we're putting the budget together, that's one thing that we're looking at is how much of that fund balance can be used to kind of offset these costs, because we do have things that stick on the budget throughout the year. Obviously, we budget every authorized position at full salary, health insurance for those that have it. And then during the year, we end up, having people retire or leave the county, and so there's openings from time to time. So there are budget savings, and that's what generates those savings every year, so that the fund balance has been increasing. So we try and budget, full percentage on those personnel costs, which is a major portion of the budget. And we do some savings during the year. And so how much of that fund balance, are we comfortable using to offset the budget? That's still what we're trying to determine as we look at all other budgets, department budgets throughout the county. Obviously, this committee, can talk about the services provided by this Health and Human Service Department. And if you've got questions or comments about the level of service, whether it needs to be increased, decreased, if you're satisfied, if you're hearing things in the community that you need addressed or like to have addressed, these budget sessions are, the vehicle to shore up any shortfalls or if there's any slack in the budget, which there just isn't anymore. So with that said, I'll open the floor to questions or comments that any of you may have.
$1 million for the bills. Is that part of the county's reserve that we have to maintain?
Now, Health and Human Services is its own fund, so that's different than the general fund. So the general fund is the general operations of the county, and so the general fund fund balance is separate from the Health and Human Service fund balance. So the general fund balance is, we've got a goal that we try and keep that between 20 and 35%. And that's the one that gets monitored, especially as you issue debts and those kind of things. That's a healthy indicator of the county. The Health and Human Services has their own fund balance because they are, got their own funding mechanisms and a lot of other things flowing through that. So that fund is a separate fund from the general fund.
Top revenues, have revenues changed at all in the past couple of years, or we always project the same and we're pretty much on target with that projection? What would you say there?
Well, Patty and I just discussed that today, and maybe Patty can put in her 4 cents worth on that. But the other thing that we talked about too, the big unknown is the COVID situation. Obviously, we're spending a lot of money on COVID-related expenses, and we do have pots of money allocated from the feds that came through the state to help offset those costs. So I think in Health and Human Services, there was like 5 different buckets of money that became available that is being tracked and being spent to help offset, the testing, the contact tracing, and the PPE, that we're purchasing. So that's all being tracked, and general government also has some money for the things that happen on our side that we expend money on COVID expenses. So, where is this whole COVID thing going to go? Is it going to slack off? Is it going to just keep on an upward trajectory through 2021? As Julia said, with the schools opening, what's that going to do? We've got a lot of unknowns, and it does change drastically, day to week to week. So making budget projections are difficult on a good year, and you have these unknowns that it really makes it difficult to project some of those revenues. As we first started, in this COVID world in March and April, we had assumed that, with the economy shut down, that things were really going to shut down for a while, and we wouldn't see the sales tax numbers, which is a major portion of county revenues. But we've actually had a better year so far in sales tax revenue. So, what do you predict? How do you predict? Are we still going to see economic shutdown as things get worse? Hard to say. But on the revenue specific to this department, Patty, do you have words of wisdom on that?
She sent me a text and said she's muted. Can you unmute her?
Can you hear me?
Yes.
Yeah.
Oh, okay. I dialed back in again, so you can hear me. I'm sorry, I didn't hear the question though. I was dialing.
Yeah, Tweet had asked the question about the revenues on the revenue side in Health and Human Services. Are we seeing any changes? Are we budgeting any major changes? How are the revenues looking in this department?
Well, our revenues are looking a bit down. They're not bad though, but our expenses are also down. Other than our out-of-home placements, we're down in travel and training. We're down in staffing costs, salary and fringe across the board because we've had many positions that we have not filled that are currently vacant. And we've also some that we've filled, but that we've held off for a period of time. So we looked at the revenue. Tom and Mike and I met this afternoon, and we looked at our things. And Mike had said he just ran our reports, seeing where Health and Human Services is at, and he thought we were not that far off of pace. And I agree with that. The things that are concerning at this point in time are our out-of-home placement costs are increasing. But like I said, any other costs that have to do with staffing, travel, training are greatly down.
Thank you.
Okay, Patty, well, we're budgeting for out-of-county placements for Winnebago and Mendota. Are we still looking at 600,000? I mean, that's a huge jump from what we had budgeted last year. And where are we tracking this year? Because I know we had some people in there, and I know Joe was thinking about or looking at maybe moving them to transitions or somewhere less expensive. Where are we at with that?
We're looking to be on pace. We're so far for this year, so a little over halfway, we're $480,000 spent on Winnebago. That's net. We keep getting a little bits of surprises. I mean, I had the meeting with Tom and Mike, and we had one set of figures, and you've got one set of figures of projections in your budget. But then one of the people that were placed in Winnebago, we found qualified for Medicare. Now Cindy went online to pull down our July report and found that he's already used his Medicare for life. So I don't know what the limits are of how much Medicare will pay for mental health services, but
190 days
so for life?
for life.
Yeah. So that's already done, but it was a nice little windfall while we had it there. So at this point in time, we're looking at 2 people permanently in Winnebago. We did increase our budget, you're right. We're projecting that it's going to be more than that, but I don't know how much you want us to project it. We did increase our out-of-home placement costs, but I guess Carla and Tabissum could really talk to that point. With COVID, it's probably harder. I'm not sure how much COVID has to play in the fact that children aren't returning from the residential caring centers, but we do have 5 kids in RCCs. We've got 4 in therapeutic foster homes, which you'll see an increase in that also. For just the administrative fees for a therapeutic foster home, I believe we've got $80,000 in the budget for next year. We had $15,000 in our budget for that. But those kind of ebb and flow. I'm not sure if that's, Carla would more be able to speak to we increased it some, but not to the total point of what we're projecting for this year. And again, in this budget, when we talked, our best guess was that we budgeted COVID through June of next year. But that was a conservative budget at the time of the staffing that we had already hired in place. And we're seeing and I totally offset it that we were going to get in enough funding to take care of it. who knows if it doesn't go away or if it gets worse this fall, are we going to use all our money up? You know, I don't know what the answer to any of that is.
Unfortunately, Patty, none of us do. Any more comments or questions? Seeing none. Jared, what do you want to do with this?
Well, we talk a lot about the out-of-county placements because it's something that's out of our control and it's a huge number. But we don't talk a lot about all of the other services, that the department provides to the community. So, as this budget, as we look at all the budgets, and this one's, $700,000-800,000 over budget. If you look at all the programs that are the services that these departments provide, you're wiping out several departments, several programs, if you're going to balance the budget strictly by cutting services, which is unrealistic. So it's such a big problem, that we try to address at the state level. That falls on deaf ears, and we keep hammering on those as well to get legislations changed. Why should counties be responsible for things that are out of our control and kind of got pushed on us by the state? But there's several other, departments and programs that the service, or that this department services that are real important and mandated. As you look at the social problems within the county, this is the department that's going to help, help with those. So.
Good. Chairman, I have one more for Tom. You know what we passed at county?
It's the third time you said one.
Tom, at the county level, we passed the idea of borrowing money to balance the budget, correct?
Yes.
And we left that open. We didn't really put an amount on there until we know what we have to add. So by borrowing money to balance the budget, does that mean that we preserve the fund balance then that we currently have?
Yeah, so, when we talk about issuing debt, the only way you can issue debt is for capital items, long-term items. You can't issue debt to cure the $700,000 operating problem at Health and Human Services. There's other operating deficiencies that we have. And we've always tried to balance the budget without issuing debt in this county, which is a very conservative, frugal way of doing things. That's fine. But now we're to the point where we don't have other things to cut. We don't have other revenue sources. What else can we do? Well, we still got some items that are in the levy limit. As you recall, there's a limit that we can levy or tax for on the operating side. And there's things that we fund within that operating levy that are capital items, that like squad cars. Historically, we've done those within the operating limits. Those are capital items. We move those and issue debt for those. That frees up that amount that we used to fund with the operating levy. So as we move those things from the operating levy out to capital, it frees up some space for operating. So you're not borrowing money for operating costs. You're doing it for debt, but it does help us on the operating side. So it does free up some of that operating levy, but when you move those expenses from operating up to capital, obviously you're increasing the amount you're taxing for, which increases people's taxes. So there's a political limit on how much you're going to be able to issue debt for, but it is a way, a legitimate way, legal way. It's fine to do. It's just something that we haven't done other than like the building, like the jail. We issue debt for that. We issue debt for the ambulance building. But these ongoing capital costs are still in the operating levy, which puts pressure on the operating expenses.
And this debt we issue, we usually can pay it off the next year. I mean, it's paid off immediately, so there's very little interest. Is that true?
That's a scenario that we laid out. If you issue debt, when you build a budget, pay it off in a couple months into the new year. You create a debt schedule that says you're going to pay off boom, boom, in January, February, whatever. That's a legitimate bonding mechanism. You put that debt service then, the debt payments within your levy, outside the levy limits, and pay that off. So, it also, if you're going to pay it off in the next year, that's a big jump in the tax rate as well. So, what we're going to talk about in the finance committee on Thursday is, the different kind of scenarios. Is that better to have that big jump in the tax rate, or is it better to issue debt for maybe, 2 or 3 years that smooths that out and kind of ramp up the tax rate? That'll be more interest, but more maybe palatable. So those are kind of things that we're talking about in finance that will kind of drive, what that ceiling is as far as the tax rate and debt level.
I don't know if you've seen it, but WCA Journal this month has a really good overview of
Yeah,
that.
Tom Cherry.
Yeah.
Yeah, there's a lot of
It's a really
very
good
articles.
overview, yeah.
And by issuing debt, we maintain our current services.
Well, I mean, you can always change the level of services. That doesn't preclude you from, increasing services, decreasing services. That's kind of independent of, the debt. But the debt will help pay for things we previously put in the operating levy. But you still have the decisions to make on the level of service you want to provide in each of these departments.
Basically, the decision is going to involve all of these options. Everything's on the table.
Yeah, they're not mutually exclusive of each other. They can all mix and match. Yes.
Any more questions about the budget? Okay, items for discussion only, and any future agenda items.
Let's talk about the budget performance report and the purchase service recap.
After we just heard about the budget, no. But I suppose we should. Go ahead.
Patty?
Really nothing more to report on, just what we were talking about on the budget. This shows you, on the RCC down in Family Services, we've already spent, what we've budgeted for the year, close to it. So that's just one example. And of course, if you say Winnebago, well, this is only for, I believe, 4 months. And we budgeted 175,000 and we've spent 345. So, but as I said, with the good news, we did receive some revenue. So net, we're at $480,000 through July. So that's looking a little bit better. But overall for the year, if you take 480 and double it for the year, or a little less than that, it's still not looking tremendous.
Any questions? Okay, discussion only, future agenda items.
Dave?
Health and Human Service Board members, after 33 years, the time has come for me to move into the next chapter of my life. Thus, I will retire from employment with Sawyer County effective October 11, 2020. As a matter of courtesy, I wanted to inform the Health and Human Services Board of this decision. I also wish to thank the board members, past and current, for the opportunity I've had to work for the Sawyer County Department of Social Services and Sawyer County Health and Human Services since August 3rd, 1987 as a social worker, and as youth justice supervisor since December 3, 2001. Thank you.
Thank
Very
you.
good, Dave.
Thank you.
God bless you.
Oh, boy.
Okay, there's nothing more, we're adjourned.
Thank you.
Good night, everybody.
Good night.